Now, this lecture is about two very important terms in medicine that cause a lot of confusion for patients: autoimmune disease, inflammation. Doctors always use those two terms when they talk to patients, and patients most of the time just accept them so nicely, as if they are so self-explaining, when actually many patients don't know much, if anything, really about them. What is an autoimmune disease and what is inflammation? In order to explain those two terms, I need first to tell you about the immune system, what it is and what it is doing in our bodies. The immune system is that system in our bodies that is concerned with protecting our bodies against two things. The first is microbes that try to enter the body, and the second is cancer cells, the cells in the body that turn crazy and start to divide crazily and in very large numbers. Those are cancer cells. If microbes try to enter the body, or if cells in the body turn into cancer cells, the immune system will immediately act against those microbes and those cancer cells. The immune system actually protects our body against microbes and cancer cells, just like the police protects our lives and homes against thieves and criminals. The police. Yes, the immune system is so much like a police organization. What we will do now, we will study together what a police organization is made of and how it works. It's all about 5 important pieces of information. After that, we will apply those 5 pieces of information that we learned about the police to our immune systems. This will very easily help us understand the words immune system, inflammation, and autoimmune disease. Number 1. A police organization is made of a large number of 3 things. Number 1, policemen and security guards. Number 2, weapons. Policemen have weapons. Number 3, communication tools. Police communicate together with those communication tools. The policemen and security guards are present everywhere in the city for protection against thieves and criminals. They are equipped with their weapons and they communicate together using their communication tools. Number 2, if there are any thieves around, the police will do 2 things. The first, recognize them and aim at them. And the second is shoot at them or at least arrest them. Number 3, this shooting or arresting is mostly associated with a process that we call a high alert response. What is the high alert response? To understand this, let's watch together a typical armed robbery take place. Note that we will later learn that the medical term for the high alert response is inflammation. What happens when an armed robbery takes place in a bank? The first thing that should happen is that the police, the bank security, is there to take care of this. They will identify the thieves and will arrest them or kill them. Is that all? No. What happens always is that the security or someone in the bank or the residents in the area call the police. You know, in banks, in offices, in shops, there's a button. When you press it, you call the police. So someone calls the police. So the scene of the robbery changes in a little while. You will find police exchanging gunfire with thieves and trying to arrest them or kill them. And soon you will find more forces with different roles appearing: helicopters, ambulance, police dogs, news reporters, more special forces, and so on. If we look at the scene from above, it will be like this. There's a very center, there's a core of fight between the thieves and the police. And around this is surrounded by emergency measures. The helicopters, the police forces, the more policemen arriving. So those measures, we call them the high alert response. Importance of the high alert response: getting all sorts of forces and services, all extra forces and extra services to help the bank security to make sure that all the thieves are arrested and the entire problem comes to a sure resolution and the crime scene is completely cleared. This is the importance of the high alert response. The high alert response is powerfully defensive and protective. But as we all know, occasionally, and exceptionally of course, when there is exchange of gunfire, innocent citizens might get injured or even killed. After that, with the high alert response turned on, one of 2 things will always happen. two scenarios. Scenario A, all the thieves are arrested and the entire problem gets under control within an hour or two, a common scenario. Or scenario B, it turns out to be a bigger gang, maybe there are hostages taken, things don't seem under control within a few hours, maybe it takes days or more. So the first scenario will be point number 4 of 5, and the second scenario will be our point number 5 of 5. Number 4, scenario A. If all the thieves are arrested, then the communications to the police station requesting more forces will stop. Rushing forces coming to the crime scene will stop. Everything goes back to normal again. What's that normal again? It's like this. The scene was like that, then it's cleared in that manner. The police has left with the arrested thieves. The ambulance took care of any injured or dead bodies. Injured and dead bodies are likely thieves, of course, but why not accidentally some innocent victims? People in the street left. Somebody cleaned up any mess. Somebody started to repair any damaged parts of any facilities. This is what you get in scenario A. Everything is cleared back. Point number 5, which is scenario B, the thieves are not arrested, maybe hostages taken. Communications to the police station requesting more forces don't stop. Rushing forces to the crime scene keep coming. Things are not getting back to normal. Instead, escalation of the high alert response continues. With that escalation of the high alert response, it looks we are less likely to see that scene, that clear scene. We are less likely to see it very soon. Instead, this is what the high alert response might result in. It results in bad damage to the facility. Of course, this bad damage is caused by the guns of the thieves, and also, why not, by the guns of the police also. And also maybe there's injury to a number of innocent victims because of continued gunfire exchange. So the high alert response over the short term is protective, and occasionally by accident can result in injury to 1 or 2 innocent victims. That was scenario A. And over the longer term is protective, but unfortunately more likely will result in injury to more innocent victims. That was scenario B. Now we will quickly revise the 5 main pieces of information we have about the police organization before applying them to the human immune system. The first one, any police organization is made of policemen and security guards, weapons and communication tools. The policemen and security guards are present everywhere in the city for protection against thieves and criminals. Number 2, if there are thieves around, the police will do 2 things. They will recognize them and aim at them, and second, they will shoot at them or at least arrest them. Number 3, shooting or arresting is mostly associated with a process that we call the high alert response. It aims to supply as many more forces and weapons as it takes to make sure we arrest or kill the thieves and have the situation under control. When the high alert response is turned on, one of 2 scenarios will always happen after that. Scenario A, the thieves are arrested within 1 or 2 hours because the high alert response made it. It was effective enough and the entire problem resolved with the least losses to any innocent victims and to bank facility. Scenario B, the thieves are not arrested and the exchange of shooting continues because the thieves were really troublesome. In that case, the high alert response continues and escalates and might also contribute to a lot of unneeded injury to innocent victims or to damage to the facility, in addition to the injuries and damages caused by the thieves, of course. Now let's apply those 5 pieces of information that we learned about the police organization to our immune systems. This should help us understand the immune system and autoimmune disease and inflammation. Point number 1. Just as the police organization is made of a large number of policemen and security guards, weapons, communication tools, and the policemen and security guards are present everywhere in the city for protection against thieves and criminals, likewise, our immune system is made of immune cells, a large number of immune cells, those are the police cells, and killing molecules, those are the weapons, And cytokines or mediators, those are the communication tools. And the cells and the mediators are present everywhere in the body for protection against microbes and cancer cells. Point number 2. Just like when thieves are around, the police will do two things: recognize them and aim at them. Second, shoot at them or at least arrest them. Likewise, when microbes are around, the immune cells will do two things. Those are the immune cells that protect the body. Those are the bad cells, the microbes that enter the body, for example. The immune cells will recognize the bad cells, and the immune cells will attack the bad cells. Number 3, just as the shooting and arresting is associated with the high alert response in the police organization that aims to supply as many more forces and weapons as it takes to make sure we arrest or kill the thieves and control the situation. Likewise, when microbes enter our bodies and immune cells and their weapons take care of this, just like the bank security did it, and immune cells and their weapons take care of this, also those immune cells will recruit more immune cells and forces to the scene by secreting mediators, inflammation substances, in order to ensure effective elimination of the microbes. So those are the microbes in the red spots in the middle, and those are the killing molecules, and those are the police cells. Now they start to call, they start to recruit, they start to secrete inflammation substances, recruiting more cells and weapons to come to the crime scene or to the place where the microbe is. We call the recruitment of more cells and weapons that arrive the inflammation. So this is the high alert response here. This is inflammation. Remember, inflammation in the medical language is the high alert response in the police language. After that, just like in the police organization, when the high alert response is turned on, one of two things will always happen. Scenario A, thieves are arrested. Scenario B, thieves are not arrested. Likewise, in our bodies, after the inflammation has been turned on, one of two things will always happen. Scenario A, the microbe or the insult is eliminated. We call this acute inflammation. Or scenario B, the microbe or insult is not eliminated. We call this chronic inflammation. So this is a very important transition in this lecture, and we're starting to see more medical terms now, and everything will become more clear now. Number 4. Just as scenario A in the police organization went on like this: if all the thieves are arrested, communications requesting more forces stop, rushing forces coming to the crime scene stop, everything goes back to normal again, and you remember the normal again was the clearing of the crime scene. Likewise, this is what happens in our body. Likewise, scenario A in the human body goes on like this. A microbe enters the body, like the sore throat microbe. This is the microbe. Immune cells, security cells I mean, immediately start to recognize and attack the microbe. So this is the security bank, those are the police cells, the immune cells. They recognize the microbe and they start to attack. They also switch on the inflammation button. They call more forces to come, more immune cells to come. So this is the calling process, and those are the more forces that are arriving. An intense fight between the immune forces and the microbe goes on. Intense acute inflammation. Acute means transient or short-lived. The calling process. This calling process is orchestrated by communication tools, mediators in medical language, or cytokines. This is the medical term. The intensity of this calling process is reflected in two important lab tests that show higher values. This is very important. The ESR, erythrocyte sedimentation rate, and the CRP, C-reactive protein test. Their levels rise and they reflect this calling process for inflammation. So you get this intense inflammation. This fight in your throat is reflected by the pain you feel in your throat and the difficulty in swallowing. Those are the symptoms. Also, the inflammation, the calling process of the inflammation may spill some mediators in the circulation and they cause fever. your temperature rises. This is part of the process, by the way. So the immune system and its inflammation response eliminate the microbe typically or mostly within 2 to 3 days. When this happens, when you eliminate the microbe, the immune cells stop calling more forces and more forces, stop calling more cells and more forces to the scene of the infection. So there's no more calling again, so the extra forces, they leave the crime scene, the inflammation scene, the infection scene. The inflammation response subsides and resolves. Cleaner cells then clear out any remaining mess and everything is back to normal. So this is the clearing of the crime scene or the infection scene. Acute inflammation, remember acute means transient or short-lived. Acute inflammation is the term given to that protective series of events that surround an immune response over a short term. Scenario B, that we call chronic inflammation. Just as scenario B in the police organization went on like this. The thieves are not arrested, maybe hostages taken, communications requesting more forces don't stop, rushing forces to the crime scene keep coming, things are not getting back to normal. Instead, there was escalation of the high alert response that continued. This is what happened. Likewise, scenario B in the human body goes on like this. A troublesome microbe that is not easy to eliminate enters the body. For example, the hepatitis C microbe, the hepatitis C virus microbe. Immune cells, security cells, immediately start to recognize and attack the microbe. The same sequence of events starts just like with the sore throat microbe. This is the microbe. The immune cells start to recognize it. They start to attack it. They also switch on the inflammation button, call more forces to come. This is the calling process. Those are the more forces that are coming. An intense fight between the immune forces and the microbe goes on. Intense acute inflammation, just like with the sore throat microbe. Same scenario exactly. And of course, the calling process is orchestrated by communication tools, mediators, cytokines. And the intensity of this calling process is reflected by those same two important lab tests, the ESR and the CRP test. This time, the immune system and its inflammation response do not manage to eliminate the microbe. So this is different now from the scenario of the sore throat microbe. And because of that difference, we will see the different coming steps. What happens next is that the immune system, the immune cells keep calling more cells and forces to the scene of the infection, but the insult, the microbe, is still not getting eliminated. So the acute inflammation that had started does not subside and turns into a more lasting inflammation, a chronic one, chronic inflammation. What is the reason for that? Inability to get rid of the insult, the microbe. I did not get rid of it in 2 to 3 days or in 1 week, just like in the sore throat microbe scenario. It's taking time. It's taking a long time. It's taking many weeks, maybe months. This chronicity and persistence of the inflammation, continued exchange of gunfire or continued shooting on the part of my immune system can likely cause injury and damage to my own normal innocent cells and tissues. Like this is the liver, this is the normal liver, and this is a chronic inflammation of the liver, chronic hepatitis we call it, caused by the HCV, hepatitis C virus infection. So more bad damage and destruction to the liver over many years might even occur and is caused partly by the bad virus itself and partly by my immune system that is attacking the virus. So a problem really arises when the attack to the body is a persistent one, so that the inflammation reaction becomes persistent too. That is, it becomes chronic, lasting, taking a long time. Chronic means it takes many weeks or months or even years. In such conditions, the inflammation reaction, which is basically supposed to be protective and healing, might itself also result in notable destruction and harm to the body. This is the point. Inflammation is a protective and positive process. Yes, it's a good one. But if it takes a long time attacking back to an insult, The insult will get a chance to make more damage, of course, because it is still persisting. This is one part. And the immune system itself, my inflammation, will also probably cause some damage to my own normal tissues. Even part of the healing process itself might also affect my tissues in a negative way. Now, this clearly explains why, at a time when inflammation is a good and protective response to the body, doctors still prescribe what we call anti-inflammatory medications to patients to stop and dampen this inflammation response sometimes. It's because in conditions where inflammation persists or becomes so intense, it might sometimes cause trouble and damage to my body. The two most common examples for conditions where an insult attacking my body persists in such a way that my inflammation reaction will also persist and probably cause damage to my body are: we have a persistent microbe that we cannot eliminate. This is the scenario, or this is the example I just gave for the hepatitis C virus, and we have an autoimmune disease. This is what I will talk about in the next few minutes. There are other causes also, but those are the most important ones, and those are the ones that I'm dealing with. Now I'm going to the target of that lecture, autoimmune disease. What is an autoimmune disease? It's a health problem where the immune system made a mistake and started to attack one type of the cells that I have in my body because it thinks that that kind of cell is a microbe attacking the body. It's not a microbe, but the immune system thinks it is a microbe. This is the problem. This is the mistake. And since that cell type is always there in my body, it will not go away. It's part of me. The immune system will keep attacking it all the time, just like the microbe that was persisting. This means that the accompanying inflammation that will occur will also persist and become a chronic one, a chronic inflammation. So you get the same things again, bad damage to the facility. You get the same things again, bad damage to the facility, innocent victims might be injured or killed, the same scenario that we explained before. In an autoimmune disease, the immune system does not attack any of the body cells in a random way. It's not random. Your immune system will not wake up in the morning just to hit any cell type in your body. It's not random. Rather, in every immune disease, the immune system likely directs its attacks to only one type or a limited type of cells in the body. In the autoimmune disease called ankylosing spondylitis, for example, the immune system mainly attacks the joints and ligaments of the neck and back. In this ankylosing spondylitis, the persistent or the repeated bouts of inflammation and the associated repeated attempts of the body to heal after any bout of inflammation can result in an unwanted transformation of the ligaments between the vertebrae into bone tissue, so that the entire vertebral column becomes converted to some kind of a one piece of bone instead of many pieces vertebrae connected together with ligaments. In the autoimmune disease called rheumatoid arthritis, the immune system mainly attacks the small joints of the hands and feet. In the autoimmune disease called lupus, systemic lupus or erythematosus, the immune system mainly attacks the kidney and the skin and also the joints, maybe other systems also. An important question will be raised here always. Why some insults to the body cause inflammation response and others do not? Why some conditions show high values for inflammation labs, ESR and CRP, and others do not? That depends on the magnitude of the insult and on the duration of time it is inducing problems. And I will explain this. An aggressive microbe, for example, the sore throat microbe, will induce a lot of turbulence in my body only within a few days. The body perceives it as a real threat to its internal security and turns on the inflammation button at once. Remember the bank robbery? It's a significant threat to security and gets initiated in only 1 second. You need to call the police at once. So this is what the body does with the sore throat microbe. It calls the police at once and turns on the inflammation button at once, and the ESR will rise. The other example, why some conditions or some problems will not cause inflammation, but they are problems still. The aging process, as you grow old, like osteoarthritis of the joints, for example, is such a slow and insidious process of tiny magnitude at any one point in time. The body does not see it as a threat and no inflammation buttons are switched on. Imagine one staff member in a big organization who is getting a tiny illegal commission from customers every day over 10 years. He might likely pass unnoticed. You might not even realize it, so no one will ever call the police. This is the difference. Now, we already introduced immune system, inflammation, autoimmune disease. Now, with the information provided here in this lecture, which I consider maybe it's a lot of medical terms and a lot of getting deep into details of medicine, not like my other lectures for patients, but with this information provided in this lecture, you can have a better understanding of two important things really at a deep level. First, your autoimmune disease. If you have an autoimmune disease and chronic inflammation, you can start to read about your disease and its management, and I'm sure you will be better able to understand the medical terms used. Search my YouTube channel, search the YouTube for my lectures about individual autoimmune diseases. Most of the lectures are in Arabic, but the process of translating to English and video shooting many of them is going on now. Second, you can now know what anti-inflammation medications, anti-inflammatory medications, what they are and how they are working. You have a good guess now about how such medications possibly work. By anti-inflammation medications, we mean here NSAIDs, non-steroidal anti-inflammatory medications. They are used to inhibit inflammation and to also control pain. And you can also read about biological medications. Most of them target and suppress important inflammation molecules in the body. Also, search YouTube for my lecture about those two items. Of course, they are mostly in Arabic language, but I'm in a process of turning some of them into the English language also. Thank you. I hope it was concise, as I tried as much as I could to make it concise, and I hope it was clear, and thank you very much.